And he informed me that not only are they doing the hard bits, they're also just starting to do soft bits. So I have my right rotator cuff is buggered. So he may be able to help me there. All right, so we are a small but elite and very clever group here, Tom. This is the clever lot. The other ones out there can stay having their afternoon tea, Susan, because we in here know where we're going to get some information that's going to A, help us, and B, there's a lot of investment potential. In fact, there's 80,000 people walking around in the world at the moment. And I know I was speaking to, where's our doctor? Where's the doctor in the house? Where'd he go? The doctor in the house here. Look at you, Paul. But Paul was saying, I like to see them when they've had a few more bites of the cherry, basically, a few more runs on the board. This one will excite you because they do have runs on the board, and there are 80,000 people walking around in the world at the moment who are already using this bit of tech that we're about to talk about. So let me get back up on the stage, not very quickly, because I went in the pool here at the Marriott yesterday. For the first time in 5 years, I thought, blow it, I'll come early and I'll have a go in that pool, because I've been looking at it for 5 years and never gone in it. And I pulled a muscle in my back trying to get out because I've got a torn right rotator cuff, which I haven't addressed yet because I haven't been exposed to the potentially life-changing opportunities that our next presenter is going to talk to us about here on stage. So Osteopore is the company. Talking to us is their executive chairman, Mr. Mark Leong. So let's hear what he has to say and see if it will change our investment portfolio and potentially our lives.
Thank you. Yep.
Would you please put your hands together, everyone, for Mark Leong.
Thank you very much. We are a different company. We are not CD19, we are not CAR-T. We are a regenerative medicine company. We focus on tissue regeneration. We use the body's own natural regeneration abilities to regenerate tissue. Osteopore is the first company in the world to have developed and commercialized 3D printed bioresorbable implants. We are in the regenerative medicine space, very, very exciting. It is the new era of healthcare, the future of medicine. Our breakthrough regenerative technology is underpinned by our proprietary 3D printing technology. We 3D print bioresorbable implants. And what's bioresorbable implants? Bioresorbable means when you put our implants in your body, it dissolves harmlessly, consistently through time. And it disappears from the body, right? So it doesn't stay in the body, our implants disappear. Very much like M&Ms, right? It melts in your mouth, not in your hands, right? So implants melt in your body, right? Put it outside, all safe. The next important feature is it's biomimetic. What's biomimetic? This little word here. We 3D print our implants to mimic the tissue that we are trying to regenerate. So it's bones, we mimic the microporous structure of bone. So when you put our implants in a body where you have a gap in your bone, for example, through accident or bone cancer, it creates the perfect environment for your body's own regenerative abilities to grow bone through and over the implant. And where that happens, the implant dissolves. So over time, what happens is all you have left is your own bone, nothing left. No foreign metals, plastics, your own bone. So you're effectively like resetting the clock to what it was, what it should be. And that's really, to us, the #1 solution. So in terms of the evolution of implants, just to share a bit of history, before the 1950s, no implants. If you break a bone, good luck. You put a cast, you cross your fingers, hopefully the bone regrows. 1950s, and you'll be surprised, yes, 1950s, you got your permanent implants like your metals and your plastics. And I'm surprised it's still being used now. Why would you use a typewriter when you can use a computer? Why use a VHS system when you can use Netflix? So fast forward today, you got your regenerative implants. So our technology is proprietary. It's multiple applications. You got bones head to toe, so we grow bones head to toe. And it's life-changing because it minimizes inflammation, it reduces complications and infections. What people don't understand is that if you do if you use a permanent implant, right, you use a metal, titanium, plastics, you have got a up to 33% risk of over a 10-year period having complications, infections, inflammation. You might get the chance to go back to the surgery table, joys of joys. If you use bone grafts, it is safer, but you got still an up to 19% risk of the bone graft being absorbed, and you got to go back to the surgery table again, so 1 in 5. Our product, because it helps you regrow your own bone and the implant disappears, has a negligible 0.01%. That is why, if you use our implants, you do it once, you get a better quality of life, you don't go back, right? No more surgeries if you're done right. And this actually addresses a huge problem with the healthcare system globally. Healthcare systems are under stress, duress. And in America, they had a study where they figured out readmissions, right? Keyword here, preventable readmissions. If you reduce that by 20%, you save the US healthcare system $15 billion. So I think our implants, which has a 0.01 risk of readmissions, would go a long way in helping reduce the strain of healthcare systems. Our technology is validated. We got tier 1 regulatory clearances in the US, FDA, Europe CE, Aussie TGA, Singapore, and a lot of other places. We have done 80,000 cases successfully. We have started commercialization. We are in 25 countries on every continent. We are protected by patents for our IP. We 3D print our products, so we've got very standard shapes and sizes that can satisfy 90% of the surgeries. The other 10%, we call it custom-made implants, where we could print anything, a rib cage, a skull, half a jawbone, easy. Like I said, we got applications head to toe. You could do skulls, you could do nose, dental, long arms, legs. We have done 80,000 cases to date, and to be honest, a lot of them are the mundane stuff, right? Simple bone regrowth and things like that. But we have gotten a fair share of world's first life-changing surgeries. Let me play you a short video.
Was the first patient to undergo the procedure after contracting a bacterial infection in his leg.
It's eaten through the entire bone pretty much. We're going to have to probably amputate it.
Now, nearly 4 years on, his tibia in his leg has regrown.
So the bone's really strong. Can't hurt it now. It's like it's solid. I walk around on it. I do daily things on it.
And that is still the biggest bone defect that's ever been successfully reconstructed in the world.
So this is a case where the option for Ruben was amputation, all right? We prevented an amputation. We helped him regrow a record 36 cm shin bone. And that is load-bearing bone. You walk and run on that bone. Next, please.
Second patient in the world to have a 3D printed implant in her leg to help regrow her own bone. The scaffold for Ash's surgery was printed by Australian-Singaporean company Osteopore. She was able to stand and even navigate stairs weeks before it was expected.
I want to pursue medicine, and I know that.
So this is a case where we treated a cancer patient. We were actually worried because what happens to the body's own regenerative abilities when you're fighting cancer? Chemotherapy, radiotherapy. She regrow a 15 cm shin bone. And as you saw the article, the doctors were amazed at her recovery speed. Next, please.
The 28-year-old from Cannon Hill has 20% vision, one leg, a crushed skull. He still thinks he's lucky despite the accident in Vietnam, which should have killed him. Initially, he'd been given a different implant, which had been the source of a life-threatening infection.
With my new skull, I have actual bone regrowing in there. I don't have to wear my helmet all the time anymore, which is very nice.
Brodie Ellis racing after regrowing his own skull.
This is a case of permanent implants. He had a permanent implant, became life-threatening infection. We sorted it out, and obviously he's having a new lease of life, taking part in swimming competitions. Next, please.
When John Manwaring lost a jawbone to cancer 2 years ago, he never expected to become part of a world-first medical marvel. 58-year-old originally had the jawbone rebuilt with bone from his leg, but that disintegrated under further cancer treatment. It's now coming up to nearly a year since he received a second implant, 3D printed by Singapore-based company Osteopore.
I can now walk in the shops without everyone staring at me.
This is another cancer patient. In this case, bone graft. Put a bone graft on his jaw. The body absorbed the bone graft, use our implants. And as you can see, he's having a new lease of life, a better quality of life. I'll skip the videos here. So look, our mission is really to be the standard of care. We are happy to do world's first, but we really think you should be using our implants. Why use 1950s technology, have a risk of infection, bone resorption? Doesn't make sense. With our technology, we think we can be a very, very valuable regenerative medtech company. And really what keeps me and my colleagues working like 7 days a week is really the impact we are doing. We know that patients are having a better outcome, better quality of life. This is our global footprint. We've got key approvals everywhere and sales in many, many countries, 25 countries to be precise. Shareholders always ask about our revenue, so I've got to show it. We've been listed 3.5 years. So you could see, generally we are able to grow our sales organically, right? Last quarter, June ended, we did 500 and almost 590,000 quarter of our revenue. Short of, your COVID and when Europe had a little bit of transition in regulations, we dipped. What is very ironic is we listed at the end of 2019, somewhere here. And the entire year's revenues for 2019 is 411,000. For the whole year, now we are doing almost 600. 2019, my market cap was 100 million plus. The irony now is I'm 10% of that, so I think there is a huge valuation arbitrage. It's one of the mysteries of the market we're trying to solve. What's going on for 2024? Revenues. We will grow revenues organically as we have been doing, and we're going to grow inorganically through partnerships, through M&A, and because we're already into the US with US FDA in Europe, the elephant in the room is China, and we got a Chinese strategy to tap that huge, huge market. We're going to focus on the craniofacial, right? That's our key core, and we got traction in the US with major hospitals picking that up. Aesthetics, that's a high discretionary spending. Dental, high volume. We did an M&A just March, so we expect higher. It's a revenue and earnings accretive acquisition, so that's going to give us good organic growth, inorganic growth in the next coming quarters. And China, we got a strategy. Don't take our word for it. Look at our announcements. You can see us having a proper strategy in each particular application we are talking about. We have a new Chinese partner for each. We are not just bones. We got blue sky, right? We are looking to speed up tissue regeneration, right? So what happens in 12 months could be 6. We can do soft tissues, right? Tendons and cartilage head to toe, soft tissues. And we could tap the animal market. Everybody knows that, we treat our pets better than our loved ones. So, and don't take my word for it. I have tons of announcements that shows that we are trying to bring our blue sky into reality. We just need some investor patience. So in summary, why Osteopore? I think as a regen medtech company, we are highly, highly de-risked. We've got validation. You've seen the world's first video. We've been established pedigree, breakthrough technology, superior outcomes, and look, we got blue sky. So thank you for listening to Osteopore and knowing what we are doing and what we'll do. We got a booth outside. Come ask questions. If you got a missing bone, let me know. Thank you very much.
Well done, bloody interesting. Thank you very, very much. Love it. Okay, we're going to stay with biotech. We're going to focus on the eyes for the next 15 minutes. Tom Spurling, MD of Nova Eye Medical. Come and join us up on the stage, sir. Possibly one of the most interesting interviews that I've done with Stockhead this year was looking at this novel treatment for glaucoma, and I was having a chat with one of you outside about it, and I've become a bit of a evangelist for this particular treatment. Whenever I go to my GP now, Thomas, you'd be very pleased to know that since our conversation, my conversation starts with, you know, when you treat people with glaucoma, do you advise them to do this traditional, you know, that we do here in Australia? And they go, yes. I said, well, have you looked at Nova Eye lately? And they go, who's that? And so I sit and I spend 5 minutes of my 15-minute consultation talking about you and how fabulous it is. So convince these guys, convince them that it's a great treatment and they should have it as part of their investment portfolio. Will you please welcome Tom, everyone?
Thank you. So we're here to talk about treatment for glaucoma. Nova Eye is, glaucoma is a failure of plumbing, fundamentally a failure of plumbing at the front of the eye. Untreated, it crushes the optic nerve and causes blindness. Our business, we will talk about glaucoma today, but we have another part in macular degeneration. We have a business, we have FDA clearance in the United States, lots of patents. We manufacture in California and in Dunedin in New Zealand. Our headquarters are in Adelaide, and we are participating in the canaloplasty segment, a segment of the glaucoma surgical devices market, which is growing very quickly. Well, back. You can see that's our recent stock price movement. The rest of the market's gone down. We've been pretty steady. There's been a fantastic increase in volume since we announced the clearance of our device in the United States back in March and conducted a capital raise to exploit that. We have the cash to do it. Our shareholding includes Australian Ethical Investments as our largest shareholder at 19%, Victor Previn, our founder, just behind that, and Salter Brothers, LIC, are also. So we have some nice institutions on our ledger, on our register. We have a proprietary product and in an established sales force, and we're well positioned to execute on the glaucoma opportunity. In April 2023, we had our latest product approved by the FDA, and we have the intellectual property and the footprint and the money now to just go and sell. And that's what we're doing. We're selling. Since April 2023, we've been selling our new product in the United States. As I said, glaucoma is about a failure of plumbing. Blockages occur, and those blockages put pressure on the optic nerve, and the optic nerve withers. Progressively, you lose sight from peripheral vision in. Left untreated. Medications, topical medications, that's putting drops in your eye, is the standard of care. The trouble with that standard of care is that people get sick of taking drops. A daily regime of having to put 1, 2, or 3 drops in your eye to maintain, to either mostly suppress the production of liquid in your eye, the protein-rich liquid which is rotating through your eye to give it nutrients. The blockages that our device clears are the drugs mostly suppress production of the fluid. So Nova Eye is a key player in the global minimally invasive glaucoma surgery market. I don't think it's there, but our revenues are currently, our last reported revenues are about $10 million US. So we are, and we forecast that they will be growing with our new release of our new product. The market is large. The market for drops, 6.1 billion within that, or glaucoma in general, within that, 670 relates to treating with glaucoma surgical devices. As I was saying, people don't take their drops, and therefore their glaucoma gets worse. A simple surgery with our device, removes or reduces the need for drops. This gets a bit complicated, but it's important. The glaucoma surgical device segment is growing very fast. Canal surgery procedures are forecast to grow at 20%, and we're well in a position to exceed those growth targets. That's how we see the market growing. That's the total market. And as I've said, we think that we can do, we're positioning ourselves for significant sales growth. That's our footprint. As I said, we're headquartered in Adelaide, where we handle corporate matters, R&D, product development, and our global marketing, regulatory and quality strategy. In the United States, we have a sales force, a whole bunch of salespeople running around selling direct to doctors, and we manufacture our HITIQ catheter in Fremont in the San Francisco Bay Area. In Germany, we have our European headquarters, and we have third-party distributors in the rest of Europe. In China, we have a well-heeled partner into which we sell our product. So we are not a startup. We've got a proven technology, proven IP, real sales, and real events happening. We're looking forward to soon reporting on our sales growth. This is the HITIQ catheter that has the principle of the HITIQ catheter is a piece of fishing line looking device that is carefully inserted into the irrigation canal that runs around the coloured part of your eye. It basically mechanically cleans and then flushes with, I say, biocompatible hydraulic fluid. It's more complicated than that, but it's benign. Flushes those canals. So I said it's about blockages. We clear the canal. We then withdraw that catheter and flush. Angioplasty of the eye. Our new product just released has a nice handheld catheter. The one before needs tweezers. You can see the doctor there using tweezers or microforceps to handle the catheter in the eye. This device is done just with a finger movement, and I've got one out on our booth there where you can see it. Very tiny catheter. That pipe, that lighted catheter has three components. It's got a light, so the doctor can see the see the catheter passing through the eye. A pipe to transport the viscoelastic into the eye, to transport the hydraulic fluid, and a bit of wire to make it just stiff enough to be able to push, but not too stiff that it pokes in out of that canal. So our HITIQ has been used in like 120,000 procedures worldwide. It's well understood by, there's another picture there. It's well understood by a number of surgeons. We have been selling the forcep version to only about 200 in the United States. With our new handpiece and the elegant slider, we think we can immediately get onto another 1,300 surgeons, and ultimately the 10,000 comprehensive surgeons doing cataract, and most likely cataract concurrent with glaucoma surgery. We think that little handpiece that we now have since April, May, will give us the opportunity to access a much larger market share. And this little picture is the centerpiece of our growth, which is currently happening. Remember, we released this in mid-April. It's now July. We are selling this, and we're looking forward to reporting our sales this month. So to summarize, glaucoma surgical device represents the fastest growing market in ophthalmology. Ophthalmology itself is a good market because everybody values their sight. Best-in-class HITIQ Advance is approved by the USA, the world's largest market. We have the sale. We're not relying on doing a deal with some large multinational who's going to maybe pay attention to our product, which is often the fate of Australian companies. This morning, while I was walking on the beach out here, our sales guy with his American accent called me to tell me how many he'd sold during the month of August, and all his sales team. They are our guys, our people out there selling. And so we're well positioned to be able, with our capital raise, to support significant sales growth. And that is our story. Thank you.
Tom, I would easily have given you minutes more there. It's really interesting, isn't it? Anyone here with a glaucoma, with glaucoma at all? You don't have to out yourself. I already know one. I know one of you has, and you're not prepared to say it, but we've got family members who've had glaucoma. One of them's 103, and he's been using the drops for years and years and years. And I just think this is an absolute game changer. And we developed it in Australia, and we're taking it to the world, and it's making us lots of money and changing people's lives. Right. Who in the room's a Queenslander? All right. It's 90% of us. Susan, I know you're not. Henry, you're not. You've come up from Melbourne to escape the cold weather. I know that. And this next one might interest you as well, especially for those of us with kids and grandkids who are playing sport. This fellow that's joining me up on the stage here is Michael Vegar. Michael is the co-founder and the MD of HITQ. Now, for those of you who are Queenslanders, and the reason that I asked that question, you would have been following with interest the reports in the last day on Wally Lewis's brain scan, correct? Yeah. So repeated hits to head and concussion have caused, I suppose, an early onset form of dementia, and I'm sure that we're going to hear more about the specifics of that in a few moments. But it's really traumatic, and it's traumatic because it could be prevented, and it can be prevented for the next generation coming through, and that's where this gentleman here is going to be key. And he's developed a tech which is not just for elite sports people, it's for any sports person. Would you please make him welcome here today as he tries to explain to us why we should be part of his journey with HITQ. IQ. Wait, let me do that again. I just said HQ, didn't I?
I was going to
let me do that again, just in case the ASX. Right, would you put your hands together, everyone, for HITQ?
Good afternoon, everybody. Very excited to introduce you all to HITIQ today. We are the global leader in concussion and brain health technologies. We provide solutions to many of the major sporting codes around the world in addressing what is the most significant issue that they have to deal with, which is brain trauma. I'm going to share some vision with you now. I apologise in advance, it's quite lengthy, but I think it's important to absorb the entirety of the video so you can actually contextualise the significance of the issue that we are dealing with. And then that'll provide the context to a lot of the rest of the presentation. So keep an eye on the fellow with the red hair in the green uniform, and I can then reference the rest of the meaning behind this video for the rest of the presentation. Thanks, Shane.
Harpany and the Broncos, and Curtis Siren in the last couple of seasons. He's a real, and he's got the job replacing. He's a positive. We're going back. He looks up and he sees. Oh!
Slipping over out there. Big shot. Horsburgh out.
Williams. There's Horsburgh.
Young. Tinman.
They left the bus really that well, so great start, I thought.
All right. Here's Horsburgh. Vanilla Blake.
Around that.
Both these teams acknowledge Thompson. Oh.
Well, they thought they were going nowhere then. Poor disappointment.
No. Runs in the horse personality of your coach.
10 minutes into the game, he's really headed to another player. Brendan Elliott, he's just got twisted up in a tackle there.
It's a tough call. Blake this time.
Just stay in the ruck, just keep it there.
He's selected IGA stores and at lock.
Does that really matter? I don't think it matters. That's an old rule. I want this. And the next bloke will want.
Here goes Horsburgh. Saka. Herculean effort.
We're down to 6.
To Levi, there's Kempy again. He had a juggle, but he kept it, and he got up.
Zip over and jump.
The Canley fans, you've got to
49 impacts, one player, one game. So let's extrapolate that out to the hundreds of thousands of kids that play contact sport every weekend here in Australia and the millions around the world. And we've got a significant issue. That's 49 brain traumas, some mild, but some quite significant. And that's happening every week. And that doesn't include what's happening during the week of training. So HITIQ exists. We have a technology that can address this issue and quantify this issue for all of the major sporting codes around the world and all of their community grassroots pathways as well. A quick overview of the capital structure. Ticker HIQ, capped at sub 6 million. I'm biased, but that's ridiculous. We are supported by the world leading scientific and medical advisory council. We've compiled the preeminent experts in this industry to support and lead and guide our scientific endeavours. So everything that we talk about today is underpinned by the scientific rigour that a group of this magnitude or this class brings to the table. So we're very proud of the talent that we've compiled and the support that we receive from an industry. So what's our strategy? Our mission is to preserve the brain health of athletes. And we're doing that in a way that no peer is addressing the problem. We're doing it in an end-to-end concussion care model manner. And there's three key pillars that comprise our platform. So surveillance. So as you see on that vision, being able to detect and quantify head impact trauma. And we do that through an instrumented mouthguard that I'll give more detail on shortly. The second pillar of our strategy is based around assessments. So being able to record and store incident data. We acquired a business out of New Zealand in 2021, which had over 120,000 concussion assessments. And based on our strategy, it was a really complementary acquisition to extend our reach across that concussion care model. And lastly, diagnosis. So having the ability to define impairment is a key criteria of building an end-to-end model. And we have a technology that we think is going to be really instrumental in being able to do this. So what is the challenge? The challenge is something called CTE. And this is what Wally Lewis is dealing with at the moment. Many people have passed who have been diagnosed with this issue. What is it? It's short for chronic traumatic encephalopathy. It is a neurodegenerative brain disease. And there is emerging evidence where research is suggesting repeat head trauma is causing CTE in athletes. And such that they've been able to quantify some early indications around how much is too much. Now, for every 1,000 head impacts an athlete is exposed to, there's a 20% increase in the risk of CTE. Now, based on the vision that we just saw, if you do the math, every year that athlete plays, there's going to be a 20% increase in his risk for CTE. And we need a solution that can track, measure and quantify these impacts, and that's where we come into play. It's an extremely strong thematic, and there's been a Senate inquiry led by the Australian government over the last few months. The report and the findings of that inquiry will emerge tomorrow. So what do we expect out of this report? Well, based on the evidence that was collated during that process, there was a clear need for technology and data. And many of the chief medical officers were quizzed around many of the issues relating to brain trauma, and all of it led back to the same issue. There was no data. So there's going to be some strong tailwinds that are going to support HITIQ moving forward, and in particular the technology solutions that we provide. And importantly, through that process, it's the first time ever that the CMOs, the chief medical officers of these codes, have acknowledged publicly a link between repeat head trauma and CTE. And I think that was a defining moment, and I think that's going to drive a lot of acceleration in the adoption of these types of technologies. And I think the other driver here is the legal component. There's a litany of legal cases that are emerging. The NFL's been sued for billions of dollars. The AFL and the NRL are in the midst of some legal action. The Northern Hemisphere rugby codes are experiencing it. So there is a duty of care obligation on these codes now. The technology's been proven. Now it's about adoption and implementation, and we're at the forefront of that process. So how are we doing it? This mouthguard's a tool of trade used by almost every single contact sport athlete in the world. Collects data at 15,000 data points a second, some of the most sophisticated technology. We're able to report on G-force, rotational force, the location of an impact, the direction of an impact, all of the key metrics that are really important in compiling an impact profile. So it's a really sophisticated piece of kit that is embedded into an existing tool of trade. We've been validated many times over, externally, independently. So we've got class-leading technology, but most importantly, we have class-leading data set. So we've captured over 500,000 head impacts across the globe, positioning us as the class leader. Our second technology solution, we have one of the key themes that emerged out of the Senate inquiry was the lack of information around concussive incidents in the community. And as part of our acquisition, the company was called CSX that we acquired out of New Zealand. They had a strong foothold in the elite market, but nothing in the community. So we've now extended that reach into the community with the development of a product called Connect, which is delivering accessible concussion care anywhere across Australia. And what we're able to do with this piece of technology is effectively build a national repository for all of the sporting codes, which gives them access to all of the point of care data around the incidents that are taking place. And what that does for the codes is allows control, but also to develop policy, inform decisions that may mitigate risk. So it's going to be a really important aspect, not only of our end-to-end solution, but also for the codes, and most importantly, for the caregivers. The other issue that we've identified through significant research is parents and caregivers don't know what to do when there's a concussion. They generally go to a GP. GPs aren't trained in concussion management. So there's so much variability in the care model out in the community, there's no trust. So what we've been able to do is we've partnered with a company called Dr. Telehealth, based here in Queensland. And what we're going to be able to deliver is standardised, best practice, streamlined concussion care via a telehealth model within 24 hours of incident. And we are in discussions with all of the major bodies regarding this product, and we're very excited by the possibilities in 2024 on this. And what this will become is the standard of concussion care, not only in Australia, but globally. And then lastly is around diagnosis. So at the moment, when somebody is diagnosed with concussion, most of the time it's an arbitrary yes, no diagnosis. But what they don't understand is what we don't have is the ability to define an impairment. And where we are at the moment in terms of what is gold standard is still pen and paper, neuropsychological testing. We've invested quite heavily into this technology stack, which is a virtual reality-based cognitive assessment tool. And what this does is assess all domains of brain function. So we're able to give a comprehensive assessment of an athlete across their whole cognitive profile. And what we're finding is the athletes are highly immersed in this process, something that the current gold standard of pen and paper cannot achieve, because what the athletes do is they fudge their baseline testing. And what they're not able to do in this environment, because of the sensitivity of the technology, is try and fudge their baseline testing. So we've had a QSub meeting with the FDA. We are tracking in our preclinical trials at the moment really well to that predicate, and we're really excited about the possibilities of this technology. And this will effectively round out what is our end-to-end strategy around concussion management. So we're really excited in terms of what the next 12 months looks like. We think we'll be entering into a clinical trial in the next 12 months on this technology. What will underpin the success of this business is the data. And we've been in existence now for close to 7 years. Our core technology, which is the instrumented mouthguard, there is such a high level barrier of entry here, and the technology development is one barrier, significant barrier, but the data collection is the next bit, which is even a harder prospect. And we've been able to achieve a world-leading position of that data collection. You know, we've monitored over 40,000 athletes. We've got over 490,000 impacts captured and quantified. We have over 130,000 cognitive assessments. So we have the deepest and the broadest data set in the world as it pertains to concussion care in sports. So we're really optimistic about our market-leading position there, and that will underpin what is our commercial strategy moving forward. Specifically in the US, there's 2 key programs that we're involved in. We've partnered with 12 NCAA Division I college programs. We've collected a significant amount of data in that market. That is a key market for us. Over 100,000 athletes just who play college football. So it's a significant market. We have demonstrated the reliability and validity of the technology in that space. So the next 6 to 12 months for us in that market is going to be really exciting. And we're really optimistic about some of the penetration in that market that we can achieve. As it pertains to the consumer market, we've partnered with a company called Shock Doctor. Shock Doctor are the preeminent mouthguard manufacturers globally. Millions of devices manufactured every year. Exposure and relevance in 20,000 retail locations around the world. So it's a fantastic marriage in terms of they bring the manufacturing and the distribution. We bring the technology and the data expertise. And ultimately, they're going to, you're kicking me off, aren't you? And ultimately, they are going to be a key pillar of our consumer strategy globally. Lastly, it's an $8 billion, we anticipate it to be an $8 billion, conservatively, a $8 billion market opportunity. We have presence and representation in all of the key segments in the market, including military, all the Australian rules footy, rugby codes, lacrosse. So we have varying levels of representation in those segments, but importantly, we are in every one of those segments. So we really have a good platform to grow there. And finally, the link between neurodegenerative disease and repeat head trauma cannot be ignored. We have the bona fide solution to address this issue and to support the codes in resolving and risk mitigating. So we're really excited. We have strong foundations in place to really grow commercially in the next 12 months or so. So thank you very much, everybody.
Thank you very much, Michael from HITIQ. That's brilliant. Well done, buddy. That's a really interesting innovation that you've put together. It'd be interesting to see where exactly it is in the next couple of years, because they do need to do something. I have one of the other dads who's here in the audience texting me saying, this is brilliant. This is bloody brilliant. And it's great for those local community sports people to have access to real data like that can back them up in decisions to keep kids off the field and keep kids off the courts, etc. too. Now, despite all the advances in diagnostics and treatments, 10 million people die from cancer every single year. And there is a group of patients amongst that who are essentially ignored. They're not an insignificant number either. There is a next generation of cell therapies for cancer. The fellow that's coming up to join us on stage, our next presenter, Stephen Yatomi-Clarke, is the CEO of Prescient Therapeutics. Now, he's aiming to keep people alive for longer and also in good health. And I asked him exactly what is it that Prescient Therapeutics does? What do the cell therapies do? Because I, like you, was reading through the little piece in the book and then I looked it up online, and he's tried to explain it to me simply. He said, it's like selling shovels and picks to those people in the gold rush era. They're treating cells like a Lego set. So you use your own immune cells like a Lego set. To explain it to us more in depth, would you please make Stephen very welcome?
Thank you very much for that. And indeed, that's what it is. It's an incredible time to be in cancer research and cancer drug development. As cancer obviously needs no introduction. If it doesn't touch us, it touches someone we love. And we all know what it's like when you hear from someone that you love and you get that terrible diagnosis, and it's touched me and my family as well. Earth-shattering stuff. But I'm here to give you encouragement, because there's been more progress made in the last 5 to 10 years than there has been in the history of medicine, and it's getting better and better and better. And it's basically because gone are the days, or certainly it's the end of the days of treating all cancers the same way. People are very different, and so are their cancers. And the 3 pillars, cutting it out since the time of the ancient Egyptians, zapping it with radiation, and poisoning it with chemo, hoping the good cells outlive the bad cells, It's the beginning of the end of that. I'm sure they'll continue to have a place, but there's this new fourth pillar of personalised medicine, and in particular, immune therapy, which I can't wait to tell you about. So we've got two approaches: targeted therapies, which address problematic switches inside a cancer cell, and cell therapies, which target markers on the outside of cells. So we take a personalised medicine approach using both angles. And to introduce the company by way of investment highlights, to zoom out a little, we take a very simple business model. We license our technologies from the best, and we work with the best, regardless of geography. So Yale, Oxford, University of Pennsylvania, and those sorts of institutions. So a real sleep at night factor with the science. We have a very healthy bank balance. We've got several years of cash runway, so we're not here rattling the tin. But more importantly, we have lots of shots on goal. So we have the pipeline of a company much bigger than us. So we've got a big company pipeline. It comprises PTX 100 I'll introduce you to, but also these cell therapy platforms. And as a result of this deep pipeline, not only risk mitigation, but certainly lots of opportunity for news flow. And these are the three pillars of the business I'm going to tell you about today. Targeted therapies, that's the here and now. That is the one deepest in development, and has the opportunity to leapfrog very deep into clinical development, producing real data now. And I've got these two other platform technologies in cell therapy, Cell Prime and OmniCAR, which have the potential to revolutionise cell therapy. So let's go through targeted therapies first. This is licensed from Yale University. And PTX 100 addresses a type of cancer that you might not have heard of. It's called T-cell lymphoma. The actor Sam Neill recently came out that he's been diagnosed with this condition. It's a pretty grim one because it's a relatively rare cancer. There's been very little innovation in this space, and it's been largely ignored. And the therapies that have been developed, they just simply don't work very well. And the classic case here is a drug called Folliton, someone else's drug. Only works 27% of the time, will help some patients and to a greater or lesser extent. That's how much it sells for per patient per year in the US, I kid you not. So I guess the point I'm trying to make here is the bar is set low for getting a drug to work, and the price is set high. So how do we stack up against that? We've got a phase 1 trial right now in T-cell lymphoma patients. This is called a swimmer plot because it looks a little bit like swimmers swimming across a swimming pool. What it's really showing you is responses and how long they're lasting. And the longer the line, the longer these patients are lasting on therapy. So previous slide, I said 27% of patients are responding to that drug Folliton, and it was approved on such. We've got 40% so far. But this is the interesting line. That line there is how far these patients get with the current therapies available today. And you can see how we're surpassing that with a great majority of our patients so far. And I can't stress enough, these are patients who have failed up to 7 different lines of therapy. So imagine that, getting a diagnosis, getting a treatment, having that fail, having to go back to the doctor, getting another treatment, having that fail 7 times. And they go into our trial and they're getting these sorts of responses. So this has the potential to be a very, very effective drug in this disease. And these aren't the best photos, but this is an example of some before and after. These doesn't look like much in these images, but that's cancer. And this is before and after. Well, it's not after, it's actually during therapy. Some of these lesions just completely disappearing. Again, this patient, 80 years old, had failed 7 therapies, and this is the only therapy that's ever worked for her. So where to from here with this particular drug? We're finishing a phase 1 study. For those that know a little bit about drug development, it's normally a phase 1, is it safe? Phase 2, does it work? And then a huge phase 3 confirmatory study costing $300 million or whatever it might be, and taking 5 to 7 years. With these rarer diseases, that's truncated right down. So this time next year, it would be wonderful. We might very well be the only company on the ASX with a registration study. So that's the trial that you take to the FDA to say, after this, can I sell my drug now? So that will be a huge inflection point for the company, maybe the biggest in the company's history. And we'll be commencing that study, fingers crossed, this time next year, if not earlier. So that's all wonderful. And I'm going to switch gears now, if that's not enough. And I'm going to talk about cell therapies, which, as the name suggests, is using living cells as a medicine. So, you know, when you get a cold and you can feel your lymph nodes swelling up, that's your body producing a whole repertoire of new soldiers in your immune system to fight these foreign invaders, but it's not very good at recognizing cancer. It has changed the game already with respect to a small group of blood cancers, a certain group of leukemias, and it's causing certain conservative doctors to even dare to use the word cure. And in certain cancers, this, believe it or not, is true. And it works like this. Michael from Aravella described this process quite well earlier on, but the blood is taken from the cancer patient and you isolate these T cells, which typically gather in your nodes when you've got an infection. But instead of fighting an infection, we now train it to recognize the cancer by putting a new receptor on it so it can latch onto the cancer. And millions of these are grown up. These are called CAR T cells. Whenever you hear the word CAR T, think about these enhanced version of your own cells. And they're given back to the patient. But like any new technology modality, the first iteration is the worst. I don't know what your first mobile phone looked like, but I bet you it's not as good as what you've got now. Same with your first computer. This is the same with this new technology, this new cell therapy. It's very real. There's 6 approved already, 3 available in Australia, but they've got these issues here. And we've got 2 platforms that address not 1, not 2, but all of the shortcomings currently facing cell therapies. And the aim is to make them safer, to make them work better, and to increase the access to patients, make them more accessible and more affordable. So where they overlap, they do so in a very synergistic manner. So I'm going to talk about them in order. I'm going to talk about Cell Prime first, which works in 2 ways. It's during the manufacturing step when someone's actually making the cells, and also when it's given to the patient. When it's during the manufacturing step, it basically, the best way to think about it, it produces more youthful cells. Currently, these get puffed out too quickly. These last longer and kill for longer, and as a result, there's some supportive data there. We can take anyone else's CAR T programs, anyone else's cells that we're developing, and by adding this during the manufacturing step, it doubles its performance, doubles its capability to eliminate cancers. So that can work with anyone else's program. So talking about selling shovels in a gold rush, this is one of those. And also as an adjuvant to give to the patient. It works in a completely different manner. It basically, think of it, if you were fighting a war, it's 9-fold more soldiers on the battlefield. 4 times more are able to breach the cancer's walls and get into the cancer, breach that membrane that they create to keep all the immune cells out. So 9-fold more on the battlefield, 4 times more penetrate the tumour, and that's why this works so well. Once again, this can work with anyone else's program to enhance what it's got. So we're not peddling a single program here, we're peddling a platform that can enhance anyone's manufacturing or therapy. So we'll switch gears now and talk about OmniCar. This is the 3rd platform, the 3rd pillar of the business, if you like. 6 minutes to go. This is licensed from the people who invented this whole field. Prescient was the first company since Novartis to license a technology from the University of Pennsylvania. And the best way to think about it is like this. The current generation of cell therapies, this is like the 6 that are approved in the US and the 3 that are approved in Australia, are static type of structures. They're very bespoke. You've got to make them patient by patient by patient. And we simply, well, not simply, the best way to think about it is we modularize these and we're effectively turning these cells into Lego sets. And you know the infinite things you can build with a Lego set. You're not just getting a car, you're not just getting a building, you can make whatever you like out of it. And similarly, this is what we are doing with cell therapies. By making it modular, we've got the ability to turn these cells against any disease and not just in cancer. And as a result, we can do things that current cell therapies cannot. So if you think about these current generation of cell therapies already approved, if it's a soldier in the immune system that's only got 1 weapon, you can't redirect it. And most disturbingly, you can't even communicate with that soldier. Once you've deployed that soldier, that's probably not ideal. Whereas with OmniCar, we've got a soldier that we can arm with any weapon, including several at once. We can have any map for multiple deployments. We can direct against any target, either sequentially or simultaneously. And most importantly, we can even communicate and control that soldier mid-mission and even send images back in real time. So this wave of cancer therapies coming through called cell therapies, that's that on the left, and you can see how we're going to change the game through modularity and flexibility and control. And this is some of the control features. We can switch them on, we can actually switch it on and switch it off so that you can use these therapies and redirect it later on. We can switch it from one target to another if the tumour mutates. Currently, if the tumour mutates, that's just bad luck. But by switching out the binder part, we can actually chase this tumour down. And you can easily, like a plug and play, if the tumour happens to have 3 or 4 different distinct markers on it, instead of just addressing one, we can address all 4 in the proportions that we need to personalise the therapy to that particular patient's cancer. So this is the future. And again, just to highlight where we're positioned in this rapidly growing field, it's very difficult to pick winners when the field is expanding so quickly. Again, the shovels to the gold rush. So that tip of the iceberg there, the 6 therapies are ready for sale in the US and in Australia. They're $350,000 to $500,000 per course of therapy at the moment. But it really is the tip of the iceberg. People are developing new cell types. When you think about it, in your body, your immune system, it's not just an army, it's an air force, and it's a navy, and many more. And people are harnessing these different immune types in addition to T cells. They've got different ways of making them, the different targets that they're looking at, and even applications beyond oncology. So this is, you'll see this in the coming years come out, all these next generation of therapies. Where are we placed? Totally agnostic. We can work with any of them. So we can enhance through both of our platforms any and all of these current and emerging therapies. And when the field is emerging so quickly, it's a good position to be in, is to be agnostic on the targets and the cell types. So we think no matter what the cell therapy, we've got a dog in that fight. So let's just finish up where we started. So again, our technology comes from the very best places with the best scientific provenance, hundreds of peer-reviewed publications, which is the most rigor that you could possibly have on a technology. We've got the cash to deliver on our milestones. I've only spoken in brief terms about our pipeline, but it goes even deeper than that, if you can believe. So we've got a big company's pipeline in small company clothing, if you like. PTX 100, you saw those results, real patient data exceeding what you would expect so far in a phase 1 study, soon to be the only pivotal trial, we think, in Australian oncology on the ASX. And these 2 cell therapy platforms that, again, giving us exposure to the fastest growing field of medicine. So lots of upcoming news flow. So many thanks for your attention.
Stephen, thank you very much. Yeah, I know, you're going, you're spot on. I'll give you a shake of the hand for that. Well done, buddy. He's spot on to the second. He's good. All right, quick little reminder to you. We've got 3 more opportunities for you. So we've got one focusing on our gut health. Our gut health is so vitally important, and they've leveraged off that one. There's a tech stock paying a dividend, and finally there's the rising challenge to preserve the health of the globe. So 3 great opportunities for you still. 2 little, one little social announcement. One is that at the end of today, we would love you to stay around and talk about what you've heard and talk to more of our presenters as well. And that's thanks to the team at Social Suite, who are our sponsors for drinks today. And if you've been seeing, my little phone's gone off 2 or 3 times then while Stephen was talking, just to announce to me that, yes, thank goodness, the interest rates were staying where they were. They weren't going up. I know for those of you who've paid off your house and are looking forward to interest rates going up, that's not great. But for the majority of Australia, it is a good thing. And it's a good thing for the tech sector as well, because they like a little bit of cash to be doing investing with, and cash at low interest rates is much better for them than cash at higher interest rates. You wanted me to talk about you, don't you? All right, take to that microphone. I'll give a little bit of a lead in, okay?
You will do. Okay,
so I'll
perfect.
lead in by saying to everyone that the United Nations has warned that humanity is in the hot seat. Do you like that? Humanity is in the hot seat. So in the last 30 days, so during July, or 31 days, 21 of those days in the Northern Hemisphere have been recorded as the hottest days on Earth. So we did some stat checking because we were talking about what it is that this particular company is doing and what they're doing. What they're focusing on is they're looking at ways of preserving our environment, preserving the world that we're living in, and not getting it hotter, etc. This fellow here is Glenn Corrie. He is the Managing Director and the CEO of Hazer Group. So let's find out what it is that they are doing to preserve our world and make it better. Would you please make him welcome, everyone?
Thank you. Great pitch, Christina. Thank you for that. From saving the body to saving the planet. So hopefully you can take a look at Hazer Group. So Hazer is, to Christina's point, I was reminded of climate change a couple of weeks ago on holidays in Greece, where I think it was the hottest day ever recorded in Europe. And it really brought back and reiterated the challenge that the planet's facing in respect of climate change, and how well positioned the Hazer is. And it's one of the reasons I joined the company back in October of last year. And we are effectively developing a low-cost, disruptive, low-emissions hydrogen production technology that will play a leading role in decarbonising the planet and really industry. We are focused on industry because that's where the biggest problems are. And if some of you may not be aware, but the steel-making industry last year contributed to about 10% of the global CO2 emissions. So hard nut to crack, definitely needs a solution, and Hazer is very well positioned to provide at least one of those solutions. We've got a really compelling investment thesis. There's sort of 8 pillars to it, so just bear with me through here. But we're effectively a low-cost, low-emissions, disruptive, proprietary technology. We've been at this for 15 years. We've spent $70 million developing the technology, and we're at a very advanced stage. We're one technology that effectively serves 3 really valuable markets, and I'll talk to that very shortly. Low on the cost curve effectively is a major competitive advantage. We know that. It drives higher margins for us, and it means that project owners and project participants are going to get decent returns from projects that involve and plants that involve the Hazer technology. We have got a growing list of interest in the technology. I'll share that with you shortly. We are partnering with some of the world's largest industrial groups and trading groups on deploying our technology in what we would call our strategic markets of North America, Asia in particular, as well as Europe. And I'll again share that with you. Advanced technology, we are TRL 7 on the NASA technology scale, so very well advanced. We're at the final point and stage before we go commercial. A very exciting milestone coming up very shortly this year with the startup of our commercial demonstration plant, which is a really important catalyst for us, which effectively tips us into the commercialization world. So something to watch out for. We're a CapEx-light business model. So what does that mean? It means we've spent the capital. We're about licensing the technology. So going forward, we don't anticipate very large requirements for capital. It's about R&D, fine-tuning, optimization, and of course, importantly, receiving license fees and royalties for the technology. My team's 25 people and equally as many PhDs. We're not about building projects. We leave that to the major companies that require the solution. Graphite is part of our story. We are, as I said, one technology, 2 products, hydrogen and graphite. Graphite, of course, is a supercritical mineral. And we have the benefits of both of those markets. So that nicely diversifies our earnings base as we get into the commercialization phase. And of course, we're in the sweet spot of the energy transition. You hear a lot about that every day. We've got the tailwinds of what is a very rapidly growing hydrogen market that we're right in the middle of and producing and developing a disruptive technology. And with all that comes very strong government and policy support. You wind back 3 years to 2020, even 2019, 3 countries in the world had national hydrogen strategies. Today, over 30 countries have national hydrogen strategies. So it will be part of the energy mix. Anyone's guess how big it'll be, but today it's almost 0. But there's only really one way up in terms of application and deployment of hydrogen as a use case. So a bit of a recap on the technology, if I may. So this is our technology. Effectively, we take methane, natural gas, or LNG, liquefied natural gas. Methane is 25 times more harmful than CO2, so it's a massive problem, and it's used, and it's everywhere, anywhere, any refinery, any petrochemicals plant, any major industrial process has methane. Effectively, what we do is we split methane. Methane chemical formula is CH4. At temperature, through a process called pyrolysis, we split methane into pure hydrogen and clean hydrogen and graphite. So how do we do that? In this reactor, using iron ore as a catalyst, which is low cost and abundant, we dramatically reduce the cost or the operating temperature and the cost of our operation, okay? There is 5 other companies in the world doing this. They all do it at 3,000 degrees Celsius. We're the only ones doing it at 900 degrees because we use iron ore as a catalyst. And that is locked up under IP in 30 jurisdictions around the world. So one technology, 3 markets: the hydrogen market, which we know is growing at 6% per annum, the graphite market, as well as what I would call as the decarbonization market. There is every company in the world at the moment trying to decarbonize or remove CO2 from their portfolios. And of course, through our technology, we will capture some of that upside. So just building on that in terms of the cost, there's 3 ways today of producing hydrogen. There is electrolysis, which is often called green hydrogen. You'll hear that referred to quite often. That effectively is very high cost. Why? Because electrolysis effectively splits a water molecule into hydrogen and oxygen. Now, to do that, you need 7 times the energy to do the same process than you would do it with methane. So always, electrolysis and green hydrogen projects are going to be at the high end of the cost curve. It's just pure thermodynamics and chemistry. You won't change that. It's 60 kilowatt hours to do that process versus 8 kilowatt hours per kilogram of hydrogen to do that process. So that differential will never change. And that's before you plug it into a renewables power grid and deal with the intermittency of solar and wind and other challenges of transporting hydrogen. The real direct comparison is with SMR, or steam methane reforming. Today, almost the entire hydrogen production industry is dominated by steam methane reforming. What that does effectively takes methane, uses steam to split it into effectively hydrogen and carbon dioxide. Every kilogram of hydrogen that is produced with steam methane reforming comes with 11 kilograms of CO2. So it's not a climate solution, it's actually a climate problem. Our disruption as a technology is to replace that with our technology, which effectively has the same feedstock in methane or natural gas or LNG, except we don't have a CO2 byproduct, we have a graphite co-product. Okay? So we have value as opposed to a cost alongside of our hydrogen. And we're plug-in. So we effectively will plug in our technology to any large industrial process around the world, a refinery, a petrochemicals plant, a methanol plant, ammonia, anywhere that currently uses hydrogen, we can effectively plug in and provide hydrogen at the demand center for the customer. And that's what we're currently doing with the 3 projects that we have got in the pipeline at the moment. We have got a rapidly growing footprint of interest and projects in the company. Okay, so these are big players. In North America, we're dealing with Fortis. In Canada, one of the largest gas utilities. They're the Alinta Gas of Canada. In France, we're also partnering with the Engie Group. It's the old Gaz de France Group. Again, $30 billion market cap. Again, one of the largest gas utilities across Europe. And in fact, I think they own the majority of the pipeline infrastructure across European gas network. And in Japan, we've just recently teamed up with Chubu Electric and Chiyoda Corp. Now, Chubu Electric is the world's largest LNG importer at the moment. I think with their partner, they import 15% of the world's LNG. So a very large industrial player looking to decarbonize their portfolio. We will be using Hazer technology there to effectively blend into their power network to reduce the carbon dioxide footprint for them. Alongside that, we're partnering very closely with the HITIQ Group Wood on EPC and engineering contractor work, as well as technology development. So, and behind this is a long list of potential other partners that we're working with across these jurisdictions including in Australia, where we're trying to help industrial players accelerate their decarbonisation by using a technology that is very well advanced and replacing existing technology that has got a very high CO2 footprint. There's a bit more detail on those projects. We're targeting having all of those 3 projects online by the end of this decade under licensing arrangements, so they're very exciting projects with very big partners. And to give you comfort on the technology, we've been around for 15 years. We started this technology in 2007. It was developed in the University of Western Australia. It then temporarily went to the University of Sydney as it developed even further. And it's enjoyed being scaled up. As we've got larger, it's got easier. We've been access to materials and engineering folks and design work and so forth. So we're on the 5th scale up. It's successfully been scaled up this far already. And this plant is about to come online. In fact, on Monday, we made an announcement where we effectively told the investor base that we have now got all of the equipment that we require to effectively finalize that project, and that will be coming on stream Q3 or Q4 this year. So a really important milestone in the company's future. And then behind that, we will be going into the commercialization of the technology with these players and others, I'd expect. That's a little bit more about the CDP. We're 95% the way through it. You'll see there the pink bit and the green bit are the 2 pieces of equipment that have just arrived. They will be plugged in over the course of the next 4 to 6 weeks, and then we will start the commissioning of the plant, which is, again, a groundbreaking moment for the company. Our business model is CapEx light. As I said, 25 people developing a technology. We're not about building plants. We're about deploying technology and licensing it out. Okay, so these discussions are currently underway with the proponents of our technology. It is premised on 2 aspects: a license fee and a royalty stream, both on graphite royalties and hydrogen royalties, as well as potentially carbon offset. Okay, so there's 3 really diverse streams of revenue that come through each of these plants that we will capture a component of as we start to build out the commercialization of it. And we've got Mitsui on board. And Mitsui, for those who are not aware, is one of the world's largest trading groups based in Japan. They have been trading coking coal forever. They have seen our graphite product. They've tested it with the market, and they have seen a number of and a variety of applications for our graphite in the market, in particular steelmaking. As I said, steelmaking, 10% of global emissions. The potential to replace coking coal with Hazer graphite, which is low emissions, is a game changer for the steel industry. It will dramatically reduce the CO2 emissions of the world's biggest contributor CO2 problem that the planet has got. So we're very excited about this. The early results have been very encouraging. We'll continue to drive that forward over the coming months. We've got a really unique graphite product. It's almost pure graphite, but it's got an iron impurity in it, which synergizes it very cleverly and closely with the steelmaking process. Almost finished. Today, most people don't appreciate that today's hydrogen market's 100 million tonnes per annum. To put that in context, the LNG market is 350 million tonnes. So it's a quarter going to a third of the LNG market today. In fact, it's valued at over the LNG market. It's valued at $175 billion as a total market worldwide. So it's mostly used in refining to desulfurize crude oil, a little bit of methanol and a little bit of ammonia, but the outlook is very, very strong. Feedstock, power generation, mobility, more industrial users, refinery, petrochemicals and others, but generally speaking, we see a 5 times increase in the market over the coming 3 decades, and I think you'll hear more about hydrogen over the coming years as we kind of develop the use case for hydrogen. I think this is the final one, but in all of our markets, there is really strong support for hydrogen technologies. I'll call out a couple of them. In Australia, we've been the beneficiary of the ARENA funding grant, which has been great. We received $10 million last year to develop our technology and advance that through a really critical stage. The Hydrogen Head Start program got released a few months ago, which is deploying $2 billion again into the market. And I want to just give a call out on the US, because the US has got the Inflation Reduction Act, the IRA, which is effectively contributing about $3 a kilogram of subsidy to the hydrogen industry. So countries are getting it. It's a clean and versatile fuel. It's a great replacement for existing industry and infrastructure. And we're getting a lot of strong government support for it. I'd expect at least 50% of our project in Japan to be covered by government funding. We got a bunch of milestones ahead. We got a catalyst every couple of months. We've got the CDP coming online. We've got, I'm out of time. We've got our Canadian project advancing towards an FID. We've got new projects coming. We've got, I think, a couple more in the pipeline. And that's our investment thesis, but a really, I think, attractive technology that's disruptive in a market today that's about to go commercial. So thank you for your time.
Thanks, Glenn. We're going to talk about gut health now. It seems to be everywhere, from products that are marketed specifically for our gut health. There's videos. If you're in the younger generation, there was recently one on gut health, #GutHealth, which had 3.7 billion views. 3.7 billion views. And if you look at the market for gut health in American dollars, it was US 47.2 billion American dollars, and it's estimated to be growing at 8.2%. It is a huge market, and we're making more and more discoveries through data, etc. Just your gut health and what sort of impact it has on outcomes for your health, from cancer through to, I mean, I've got kids who've got celiac disease and all sorts of things, and mental health diseases as well. You know, was that saying that your mother used to say, you know, looking after your happy mind, or happy tummy, happy mind, just little simple things like that. But strangely, it actually means something. And what could it mean in terms of your investment portfolio? Well, this happy looking fella here, who's taking second last slot today, we're saving some of the best to last. This is a really interesting conversation. So Microba Life Sciences is the company that we're about to hear from. And this is their CEO, he's Dr. Reid. I'm going to sit down because I could keep talking about it for ages. It is a topic I'm very passionate about, and I'll be interested to see if you can get me to actually invest in what it is that you're doing at Microba. Please make him very welcome, everyone.
Thank you. And wonderful to be here to talk about our company, Microba Life Sciences. So I think we're about 2 hours post-lunch, and I want people to think about their lunch decision. So some people going for the cold potato salad, high in resistant starch, well done, good choice. I saw some people going around the corner and going for the sweets, no judgment, everything in moderation. But I want you to think now for a moment about what happens to that food. So it's traveling through your digestive tract, ultimately where it collides with trillions of microorganisms that then produce a vast array of bioactive compounds that act both locally in the gastrointestinal tract, but also systemically throughout the body. And we now know are absolutely essential for maintenance of health, but also in the development of a range of chronic diseases. So at Microba, our investment thesis is that those trillions of microorganisms, known as your gut microbiome, represent one of the biggest untapped opportunities to improve human health. That will see microbiome testing and therapeutics become a routine part of healthcare, and we believe that we have the best technology in the world to unlock that. So over the last 5 years, based on that world-leading technology, supported by peer-reviewed publication and our two co-founders who are in the top 1% of cited researchers globally, we've been building to establish a global dominant position in both microbiome testing and in therapeutic development from the microbiome to capture those opportunities. And our commercial model to execute on this is outlined here. We deliver testing services globally to clinicians, consumers, and research clients, together with market-leading distribution partners. Those services, now for 5 years, have been building this large proprietary data bank with consented and de-identified customer data. Then we've been mining that data to discover and develop these novel therapies and ultimately execute pharma out-licensing transactions on those valuable assets. We're a data-driven biotech company, but we're commercial stage and already delivering international revenues today and delivering strong year-on-year growth. Our Our testing services are now expanded into 13 countries. We've established a range of really valuable partners, both on the testing services side and our therapeutic development side, which I'll take you through in a moment. That data bank has become a globally unique asset. We believe it's the most valuable of its kind globally. And from that data bank, we have 3 therapeutic programs, and we've just moved our first lead drug candidate for inflammatory bowel disease into a first-in-human phase 1 clinical trial. And underpinning all of this, we've established a truly world-class team, including Deputy Chair and Chair of our Medical Advisory Board, Professor Ian Fraser, who's the inventor of Gardasil, the cervical cancer vaccine, which is now a significant drug for Merck, generating over $7 billion in annual sales. And also our Head of Therapeutics, Professor Trent Munro, who joined us from Amgen in California last year to move our therapeutics into clinical development. We've just closed out a really big half of the year and quarter with a range of significant milestones. At the end of last calendar year in December, we entered into a major strategic partnership with Sonic Healthcare, and they became a substantial shareholder, taking a 20% equity stake in the company. And what we laid down with that partnership was also a basis for them to be able to distribute their testing across their 7 major markets. And last month, we just inked the first of those distribution arrangements to take our technology, and in particular, a new test, Australia-wide together. So we're excited to move that into launch next quarter. And I'll give you more insight into that product and what it is. Our second major milestone was continuing our expansion work with SYNLAB, which is Europe's largest pathology company. We signed Brazil during the quarter, opening up South America to Microba for the first time. And that's adding on to the additional 6 countries that we had recently signed, continuing to expand access to our testing across Europe and Latin America. In addition, just a quarter and a half ago, we launched a new test which we call MetaXplore. That test I'll tell you more about in a moment, but we've experienced really strong growth and uptake from healthcare professionals and patients of that testing, best exemplified through 87% growth between March and June, showing that we're off to a really rapid start with that new test into market. And finally, we matured into a clinical stage drug development company, taking our first drug candidate all the way from discovery through to manufacturing of a drug product with excellent preclinical profile into a first-in-human dosing in a phase 1 clinical trial. So I'm going to take you quickly through our testing services and then switch gears to talk about our therapeutics. But first, to outline what we're doing here on our testing services business, we're building a leading microbiome testing company through a globally scalable distribution partner model. That model enables our partners to access our platform to deliver a microbiome test powered by our technology into their major markets, and we're moving quickly. The core of this testing business is these 2 healthcare products. MetaXplore, which I just mentioned before, launched just over a quarter and a half ago, directed to individuals that have what's known as a disorder of the gut-brain interaction. So these are chronic GI disorders covering functional constipation, functional diarrhea, irritable bowel syndrome, and a range of others. It's estimated that there's over 150 million of those addressable patients that are currently underserved by the current testing options available to them. And there's a significant component of the microbiome that's influencing those chronic GI disorders. So this test is now in market. As I mentioned, 87% growth between March and June. And we've also seen significant growth in healthcare professionals signing on to access that testing and registering with an account, with 480% growth quarter on quarter, which is the leading indicator for growth for that product. Our second product we just announced last month with Sonic Healthcare, called MetaPanel. That technology leverages our core metagenomic analysis to be able to perform comprehensive gastrointestinal infectious disease pathology also covering off virulence factors so that you understand the detail about the pathogen that you identify, together with antimicrobial resistance gene profiling so that you can specifically target and treat that organism. The initial beachhead market for that test is in high risk and immunocompromised individuals within a hospital setting where a gastrointestinal pathogen presents as a significant risk to that individual, either in a complication from the surgery, longer stay and cost for the patient in terms of time in hospital, and ultimately a high risk of mortality. It's estimated there's over 16 million of these addressable patients per annum. We're excited about the opportunity domestically here as we move to launch with Sonic Healthcare, but also internationally, and particularly in North America, where we've seen strong pricing opportunity for this product. And we've also been able to clearly define a path to launch that testing quickly into the US market through a hospital direct bill strategy. So what that means is that as we move to launch this in Australia, we can quickly follow suit into North America and open up that market to us. So we've got market-leading products at the forefront of this emerging microbiome testing sector. We've also got excellent distribution of those products. We've built carefully a leading bench of medical diagnostic leaders to take this testing into market with us internationally, including major shareholder Sonic Healthcare across their 7 major markets, Synlab, Europe's largest pathology company, providing access to Europe and Latin America, Genova Diagnostics, which is the leading GI pathology company in North America, and finally G42 Healthcare, which covers the Middle East. So with those partners, we now have access to 35 countries, and we've operationalized 13 of those countries today. So this opportunity that I see for our testing business is significant. We're at the forefront of this rapidly emerging market. We ultimately see that this testing will become as routine as a blood test in health and chronic disease management. And certainly that was the basis for Sonic Healthcare's investment. What success here looks like for me is that we become the Ariosa Diagnostics, or the foundation medicine of Microba. Ariosa Diagnostics were at the forefront of prenatal genetic testing, ultimately built to around 50 million US in revenue and sold for around 600 million. Foundation Medicine ultimately were a pioneer in cancer companion diagnostics, grew to around 200 million in revenue and ultimately sold for around $2 billion to Roche. So we're excited about the growth opportunity for that business, both domestically and internationally, as we move these tests into market. So that's our testing business, generating year-on-year growth in revenues and sales. But in addition to those growing revenues, it's also generating that valuable data that grows our data bank, which is the foundation for discovery and development of these novel microbial cell therapies. We've made rapid progress here, and we've really matured this part of our business since our ASX listing last year. We're developing drugs that have demonstrated novel, compelling biology in a preclinical setting, strong preclinical safety profile, and we've demonstrated the ability to scale in manufacture, which has been the stumbling block for many of our peers in this space. Underlying that, we've built a multidisciplinary team and assembled a really fantastic set of partners to progress these programs through clinical development. And the heart of all of this is our data-driven drug discovery platform, which starts on the left with our large proprietary data bank, where we have a core healthy population and we have defined disease groups. We can then interrogate that data using advanced biostatistics and artificial intelligence methods to find what one of our co-founders calls the needles in the haystack, the key organisms and associated biology that represent therapeutic opportunity. We bring them into the laboratory, isolate them, study them for the first time, and look at them in a range of preclinical models, and then ultimately scale them up in manufacturing and bring them into human clinical trials. And that's exactly where we are today. So we have 3 programs spanning inflammatory bowel disease, cancer immunotherapy, and autoimmune diseases. As I mentioned before, the inflammatory bowel disease program has gone all the way through to discovery, now to first dosing in humans and due to read out from that phase 1 in December this year, a really important catalyst for the company. Our cancer immunotherapy program is developing an adjuvant therapy to improve response rates to cancer immunotherapy, particularly immune checkpoint inhibitor therapy. We've demonstrated strong preclinical animal data, and we're moving quickly now to round out that preclinical package and get to lead candidate selection, ultimately setting up for a phase 1b clinical trial. And finally, we have an interesting program in autoimmune diseases covering psoriatic arthritis, autoimmune liver disease, and lupus. We've got a discovery program underway with New York Stock Exchange listed and synthetic biology leader Ginkgo Bioworks, who also became a major shareholder in our IPO. We're really excited about the opportunity ahead for each of these programs. Importantly, Microba doesn't see itself as a late-stage drug developer. We have a genuine platform for drug discovery from the microbiome. We have leads established for 18 chronic diseases. We're intensively focused on 3. So our job is to do initial preclinical and clinical de-risking, and then ultimately execute pharma out-licensing transactions with the right strategically aligned partners. And there's a range of deal precedents ranging from $500 million up to now $11 billion. The example at the top, where Merck just acquired Prometheus Biosciences based on the readout from their phase 2 trial of their inflammatory bowel disease asset. So just to close out, I'm at time. We've just closed out a really significant half of the year, delivering on all of our promises and milestones for investors. We've got a really significant set of milestones, both on the testing business and on the therapeutic side over the next 6 months. We're in a strong position with $32 million cash at bank, and are really excited about the opportunity and value inflection points that will be unlocked for shareholders over the coming quarters. So thank you very much for your time, and please come grab me to have a chat.
Thank you, Dr. Luke. Now done. Right, I'm feeling very smug about my morning tea selection now, even if it was because it was the last thing that was left. You know, the little slicey thing with the seeds in it? I'm feeling good about that. Right, our final company to present today, a little bit different. They've got a $150 million market cap. They've paid a dividend for the last 2.5 years. A lot of the companies that you've heard here are in their early stage. This one's been around for about 40 years, and they've been strategically wrapping tech around their business, investing tech in their business and changing the perception of a well-known Aussie business. In fact, they had one store back in Perth, in my hometown, back in the 80s, and now they've got 700 globally. If anyone went to Paris this summer, it wasn't me, but if you got there, you would have seen a cash converters there. So this fellow here has been charged with changing the perception and doing some amazing things. But he's been involved since 2016, took on leadership in 2019, and today it is a very different beast than it was back then. And Sam, did I say your last name? Is Budiselik?
Yep, that's
okay,
good.
Sorry. So Sam Budiselik has been there for a number of years. He's made some amazing changes to this business. The wrapping of the tech around it, though, and the way that it's transformed the business has been really interesting. So let's hear what he has to say. It's our last tech investment opportunity for today. Please make him welcome.
Thank you. Thank you for holding back and listening to my presentation. I really appreciate it. I'm always pretty excited to bring cashies, or cash converters, we call it cashies internally, back to the market. I did, as Chrissy mentioned, started about 8 years ago on a mission with cashies. It was an unusual sort of challenge for me with a finance background. Looking at the business, I really got quite excited about the size of the business, the number of customers that the business has dealt with over time, our mission of financial inclusion and doing that in a better way with new product, lower cost, and a whole new approach to our responsible lending commitments. I did just want to start with a brief summary as to who we are. If you have dealt with us over time, you might have been in a store a little while ago, and our business model's changed quite a lot. You'll see that we've really overhauled our store experience. A lot of the fit out sort of modelled on an Apple tech lab kind of look and feel. The store experience now is really modernised, and I think the trading nature of the business has really lent itself well in the current environment of consideration around circular economy and ESG considerations. To have a safe environment in a second-hand retail space is quite a unique proposition from our business that we offer. In saying that, our business has really changed over the years. We're predominantly, we think about ourselves as a personal finance company. About 65% of our earnings come through our personal lending business, online and in stores. About 25% of our earnings come through our store operation, the retail trading, buy and sell, and the final 10% also comes through our franchise royalties and global franchise network. We think about our customers as special people. It's a part of the economy that's not well served. There's a cash need in that part of the economy. I'll talk about our customer in a little while, how we might define that customer that we look at in our market space. But meeting the cash needs responsibly of our customers is really our primary mission, whether that's someone selling us an item that we retail, whether it's someone who's value conscious looking for an opportunity to pick something up that maybe they otherwise couldn't afford, or whether it's a personal finance or car loan. We're there for our customers in that respect. The second point's really important to me. I think you might be thinking, why is Cashies at a TechKnow conference? It's a bricks and mortar retailer with a long history that's probably better known for retail than anything else. We've invested really heavily in our business over the last 5 to 7 years. Some years $10 million or more, building a financial platform and a tech platform. So our customer-facing assets are really first class. Everything that we build out of Australia, either Perth or Brisbane, are where our 2 hubs are. We've spent a lot of money, obviously, in a retail or a lending business. You have to be there for the customer online, and you have to make that a frictionless experience. We are fully regulated under the National Credit Act, so we have to meet all of our responsible lending obligations in that process. And I think under the hood, there's a lot of technology in play to enable us to quickly and responsibly assess an applicant for a loan, a small loan. It could be an average sort of $1,000 loan, to do that in a compliant way, and then to run a credit overlay on that and meet all of our obligations. We obviously heavily rely on our technology. I think globally, we've then really taken the model global predominantly through franchising, and I'll talk about that in a little while, but we're just starting on a process to acquire our franchise network back in Australia. And I think as a large financial service provider, it's difficult to operate a franchise network in these markets, and we're looking at acquiring a number of our stores back over time. But we're obviously listed. Some of these stats on here or points on here are just because I feel we're a bit misunderstood. We've had a long history operating in Australia. We've got 700 stores globally now. We're a big scale business. We might receive on average 50,000 applications a month for a small loan. Through our stores, a small amount, online a large amount. And we have to sort of run our processes to ensure that the applicants coming in and the loan is suitable and that we're willing to take the credit risk. If you can imagine sort of lending someone, any one of your mates, unsecured money, it's always a good idea to sort of look at the propensity to get that money back, and that's really what we're about. And we are regulated by ASIC, AUSTRAC, and we do belong to AFCA. So similar to the banks, we've got the full responsible lending overlays on us. And I think as a function of dealing into our part of the market, we've got extra overlays, which are sensible protections that exist under the Credit Act that are very important. And I think that regulation works well. And if you sort of think about the buy now, pay later advent over the last maybe 7 or 8 years in full force, and that's sitting as an exemption under the Credit Act, it's not regulated, it's caused a lot of issues that are going to play through in our economy over time. And I'd love to talk about that in a little while. With a big business, I think we might have served over 10% of Australia's adult population over time. When I look at our customer records, we've got a lot of customer data. For every loan application, we take 90 days of banking. We've got credit files that aren't that useful. I'll talk about that a little bit. We build our own risk scores, but we've got a big business that has hard assets of loan books and inventory, and we've got about 200 million of assets on the balance sheet. It's an NTA of 29 cents, and we're trading sub that. So like a lot of the companies you hear today trying to take the story forward through the market and realise value, it's really important, I think, that we get out and talk about how much great work we've done over the last few years. We do turn an EBITDA. We've got revenue of around about 250 mil a year. Our half-year EBITDA, 31 December, was that number there of 28.9. We've got about 60 mil of cash on the balance sheet. So in summary, we're really in a strong position to continue investing in our strategy, which I'll talk through in a minute. We do pay a 1 cent dividend. We started that 3 years ago, and we've paid 5 halves now. A global network, something that I think we should be proud of. As an Australian company, we've really gone global, and I kind of pinch myself at times when I'm walking around France or Spain and I see our stores around. I think the model's really lent itself well to export overseas. Not an unsecured lending model overseas. It's more a retail buy-sell model that operates offshore. We've recently acquired our New Zealand operation, which was franchised. Our South Australian franchisees went to New Zealand and built out 22 stores, and you can see there that half are corporate and half are franchise. On a similar vein, in the UK, we've just acquired our largest franchise operator in the UK, a company called Capital Cash that was operating with 42 Cashy stores. We have operated corporate stores in the past in the UK, but we've just decided to go back in recently because we see a good opportunity to start to expand into Wales and Ireland where we don't have stores, and the model lends itself well culturally. Predominantly the Belgium, France and European operations in South Africa are franchised, where we support our partners offshore, and we've made loans over time into some of those entities, and we have some equity interests. We've got 14 countries, 688 stores, and we employ a lot of people in Australia across our corporate and our franchise network. Just briefly, like I said earlier on the opening, our business model is really one about operating personal finance product and loan books sold through our stores and online. Our loan books are growing quite rapidly. We've just moved north of 250 mil. We're at about 260 mil of gross loan book, and I'll show a breakdown of that in a minute. But the products are predominantly unsecured loans for $2,000 up to $5,000. They're small amount and medium amount contracts under the National Credit Act. We do have vehicle finance, and we do have a small pawnbroking book. The pawnbroking book's about $12 or $13 million out of that total $260 million. And then we've had a couple of new product releases, and the new product releases are really the culmination of many years' work trying to solve this challenge of responsibly risking someone and then bringing down the cost of credit. And we operate into sub or near prime markets, which I'll talk about in a minute. It's very difficult to attain any external information about our borrowers when they're coming into to us for help, and we've had to really build and invest in that technology to build a risk profile and a risk score for these customers when they come in. We've got big scale. We're processing a lot of throughput. We've worked really hard to integrate our technology into the new payments platform and some of the payment rails the Australian government's put on offer for instant disbursement into bank accounts. There's no more cash changing hands like there might have been in the old days. But we're well positioned now, having spent significantly on our platform to leverage our platform, and that's really, this point in time, we're looking to really grow our business. Briefly in terms of the addressable market, it's a large market in Australia. One of our stores is quite unique. There's a lending operation running under the roof of the store. There's a retail buy and sell operation running under the roof of the store, and there's also an opportunity for people to bring items of collateral to borrow against or pawnbroke. And when you walk into a store, all of that's quite uniquely sort of seamlessly integrated. What it does mean is that there's a fair bit of crossover with our customers coming in presenting with a need, but there's also not. There's a lot of middle Australia that do come into the stores and have a look for a unique item or a high-end watch or handbag or pair of trainers that are really predominantly sort of the inventory base now. So you'll have electronics, jewellery, trainers, handbags, luxury goods, whereas in the past it was probably more lawnmowers and whippersnippers and different retail items that we housed. We have about 20% of our retail sales transacting online, Our stores are quite unique. They procure all of our inventory from individual customer transactions. We don't wholesale purchase anything, and they dispatch from those the 150 locations around Australia to distribute that inventory. So someone could walk into a store and buy that piece, or we will dispatch and transport that as well. And in the online lending space, the online space is a high volume, low approval rate kind of environment for finance applications. Whereas in store, we have a very strong relationship with the customers that we're serving, and it's almost a commitment to each other to be there for each other over time is how that relationship unfolds. So we'll have quite a high approval rate through the store network where we can get a very good view on someone and really understand their needs and their position. But we'll definitely use technology online to decline a lot of the application flow that we just deem too risky or unsuitable. And then finally, our vehicle finance business, it operates under a different brand name called Greenlight Auto. It's predominantly been a B2B business distributed through brokers and dealers, and bringing that into the Cashies universe has only happened over the last 2 years, where we can now offer our Cashies customers car finance as well. But big growing markets. I think the banks sort of moving back in terms of their risk tolerance off the back of the Royal Commission. It's really opening up a bit of a void in the middle sort of credit market. And there's always been a bit of a void in the subprime credit markets. It's been really underserved, I think. And that's really what we're really trying to challenge ourselves to do better, is look after those customers in a better way. At the end of the day, I thought the battery had run out. Yeah, so just briefly, how we think about our technology. We've obviously got our core platform. All of our point of sales built in-house. You could imagine the complexities of a retail business with a pawnbroking element with a lending business. It's quite unique. All of that's built in-house, all of that's scaled globally. So we will provide platforms to our global partners. In some of the jurisdictions where there are more stores, those franchise partners will then take those and localise those, but typically we support those. We've had to build our own banking infrastructure to enable us to plug into wholesale banking providers, because we ourselves can't get onshore funding at times due to the political environment around dealing with subprime customers, which I think is something that as a nation we should be a bit ashamed of and we should look to solve. And then we've had to offer all of the apps and the customer-facing interfaces for lending, which obviously when you're taking bank statements and storing personal finance data, security is of paramount consideration. The customer, like I say, we've got the web apps, the mobile apps, the single view, and the big data lakes. So we've got a lot of customer records to mine. And then we've got machine learning running our credit models, which is really the core essence of our secret sauce and how we power our business, and that is what gives us a real advantage. I think I might be out of time, so I'll leave it at that, but thank you very much for listening, and I've enjoyed speaking to you. Thank you.
That's all right, Sam. We like a bit of secret sauce and knowledge on the secret sauce. Thank you very much for rounding it out today. We appreciate it, don't we, everyone? Yes? Thanks, Sam. And interesting to see how you pivoted and really grown that business too. Now, we were going to have a panel up the front here, and we just had a bit of a think about it. And while we have the likes, and he's looking at me,